To help matters now, the National Assembly has urged the Nursing and Midwifery Council of Nigeria to reopen its website and resume verification of nurses and midwives using its former guidelines pending on investigation by the House Committee on Health Institutions. This directive was communicated in a letter dated August 13, 2024, signed by Clerk of the National Assembly, Mr. Sani Magaji Tambuwal. The decision follows a motion raised by Honourable Patrick Umoh on July 23, 2024, stressing the need to protect the House's integrity. The House had previously instructed NMCN not to implement revised guidelines from February 7, 2023 during the investigation. However, NMCN shut down its verification services, leading to concerns from global nursing boards about verifying Nigerian nursing certificates. The group known as the Nigerian Nurses' Voice have been at the forefront, calling on the government to intervene. Well, to discuss this, we are joined by a nurse, Alexis Isioma. Thank you so much for being here, Alexis. All right. Thank you for joining us, by the way. But how will the directive from the National Assembly that the Nursing and Midwifery Council of Nigeria, NMCN, reopen its website and resume verification of nurses and midwives impact heavily, especially on nurses and the health sector generally? I'd like you to please do well to unmute your device if you can, so we can hear you clearly.
Okay, can you hear me now?
Perfect. Please go ahead.
Good morning, and thank you for having me. I am Nurse Alexis Isioma. So the verification portal, when it's opened, right now, as I'm speaking to you, so many of our nurses in Saudi has been sent to come back home. Some that have even resigned from their job here in Nigeria due to this whole verification, because without that verification, their data flow cannot be sent to the Saudi government or the nursing board over there. Also, the Texas Board of Nursing has also written some of our nurses that they cannot continue with them until NMCN verifies their license. And that is where we are today. So many things have gone wrong these days. Now, some of our nurses, even the diaspora nurses, not just Nigerian nurses, the diaspora nurses cannot move from one state to another. If you're practicing in US, for example, you're practicing in one state in US. If you're to move to another state, you need to be verified again by the Nursing and Midwifery Council in Nigeria. And if that is not done, you are left there you cannot even move forward. And that is where we are now. And that is why we cried out to the House of Rep. And they have spoken up, and we await the Nursing and Midwifery Council to open up the portal with immediate effect. Thank you.
All right. So can you please tell us how bad is this? Especially, how is it affecting nurses who are outside of the country? How bad really is it?
Like I stated earlier, it is very bad because most of our nurses, they are just on standstill now. Career-wise, professional-wise, they are not even able to move from where they are. Some of them can no longer practice. That is how bad it is. They cannot be verified because they need NMCN to verify them. That's the Nursing and Midwifery Council in Nigeria here. To verify them, that's to authenticate that the license was issued by them here, so that they can move forward with whatever they are doing. Even those that have gotten jobs over there, they can't even start the job without that license being verified. Those that are already working there are also affected because they can't move from one station to another because you still need that verification. That is how bad it is. Then, like I stated earlier, in Saudi Arabia, there's what we call data flow. It also requires verification. Now, more than 2,500 nurses have been sent back from Saudi that we are practicing due to this verification. They told them, I have some evidences which maybe I will be sending later. They told them that without that verification, they cannot move further with them. And that is where we are. I don't know how you'll be punishing people just because of something that you can handle. Thank you.
All right. Anyway, what solutions do you think needs to be put in place now that you've taken it as far as going to the House of Representatives? What are you expecting to hear?
I think we've already heard what we are expected to hear. We've heard it already. And that is the circular that has been passed. The motion has been moved and a resolution has been reached. And that resolution should be followed. The resolution states that the NMCN should open up its portal with the old verification guidelines and start verifying nurses immediately. Because this was what they stated earlier in March, which Nursing and Midwifery Council misinterpreted, and they closed down the verification portal, suspended it, and wrote boldly on their portal that the verification portal has been suspended due to the House of Representatives directives. And that wasn't the directive, although. And now, when we cried back again to the House of Rep, a motion was raised again by Honourable Patrick Umoh, and a resolution has been reached again. And it's boldly stated in that letter that you're saying that the Nursing and Midwifery Council should go ahead and verify nurses immediately with the old verification guidelines. And we expect that to be done within this week.
Okay.
Thank you.
All right. Thank you so much. Well, we hope to get a feedback, especially from you, and hopefully it will be resolved within this week. Thank you for joining us, by the way.
Thank you very much. I appreciate it.